Hello again. I am Bianca, Calista's mom, and I am just going to continue telling her journey with the jaw distraction surgery. So, as you know, yesterday was the big day. She went to Children's Hospital to have the jaw distraction procedure, and I just want to explain to you in detail exactly how it went so you know if you're ever in this situation what to expect. So, one new thing they do, it's not new, but one thing they do, which is new for me, is they give you an armband. This armband helps you identify who you are and who your child is. So if you were to go home and come back, then you would have access to your child, which of course is important. I have to tell you, so yesterday it went pretty smooth. I was very freaked out, very emotional, although I didn't cry, but as any parent would be. But I have to say, the way they did it yesterday, it really helped me through it. Like, let me just explain. When I got to the hospital, the first thing you have to do when you go to the surgical department is get registered. And when they register you, they give you like a beeper, exactly like the ones in the restaurant. The little round one with the red dots, and it vibrates and make a noise, so you know, like when they need you, it'll go off, it'll notify you, you can go to them and whatever. So they give you a beeper, they give you an armband, they put one on the child, they will ask all these questions, basic questions. Have you traveled? When was the last time your child ate? Because as you know, when you have a surgery, you have to have an empty stomach, so you can't eat after midnight. So after they did the questions and get your insurance information squared away, when it's your turn, they call you in the back. In the back, you have a team of people who will talk to you one by one. So, of course, the anesthesiologist team, they'll come in, they'll explain what they're going to do, they leave. They told us, basically how they were going to put her to sleep and keep her comfortable, what the plan was after, whether or not they would. Their plan was to, because she has a tube breathing for her during surgery. So their plan was to take the tube out as soon as the surgery was over to see how well she could breathe on her own. So they were just explaining that to me. Then plastic surgery came in and they were explaining the jaw distraction again, how they were going to do the surgery. He did say that there was a possibility that they would not do the surgery if ENT came in and felt that it wasn't really needed, because what they do is they take a camera and they stick it in her nose all the way down to get a good look at her airway to verify whether or not a jaw distraction is what's best for her. I don't know if I mentioned this, but every Pierre-Robin sequence or Pierre-Robin syndrome child is different. So there is no one way to treat them. So, sorry. My nerves are bad. I have trouble breathing. So they were just gonna verify if that is what is best for her. If so, they would continue with the surgery. So then ENT came in and she explained, looking at the camera, but then she hit us with some brand new information. Apparently, Calista has had fluid in her ears and it has resulted in 40% hearing loss. So they were going to as well put like two little tubes inside her ear that are supposed to help drain the fluid over time. And it should be there about 6 to 8 months, and they will fall out on its own. So I had to sign consent on that procedure. So she was going to get 3 procedures done. So the first one is the in-depth look at her airway. They consider that a procedure because you need to be asleep, and so that. Then it was the ears, her ears, and that what ENT also did before surgery. The way they test to see if she was a good candidate for a jaw distraction is they use their hands and kind of put her jaw forward to see what her airway looks like inside. And they took pictures of it, which I have somewhere around here. So when they did that, they saw that it created a clear path for her to breathe better, so they decided to go ahead. So it was the in-depth view, it was the fluid in the ears, and then they did the jaw distraction. So once we got the okay that, yeah, she needs a jaw distraction, they gave us our beeper, and my husband and I were free to do whatever we needed to do while we wait. And they will beep me or page me if they needed us or had something to tell us. So we had decided, to get something to eat because we hadn't eaten all day. We had been up since 4 in the morning. So while we were eating, our beeper goes off. And we just left. So we were like, what's going on? They're beeping us way too early. Did something happen? So we dumped our food in the trash, even though we were hungry. And we rushed, like, excuse me, we gotta get. And we get there, and they're like, everything's okay. The ENT finished their part, so, they just wanted to update you. Have a seat in the conference room, and because they have like little private rooms to talk to the families, so you're not like out in the open with everyone else in the waiting room, which is nice. And she came in, she gave us a picture of her airway, reassured us why they felt that the jaw distraction was best for her, and that she did fine. She seemed comfortable, everything. Her stats were normal, and, the plastic surgeon will notify me when he was done with his part and surgery was complete. Sorry. That weather, man, it gets to you. So, we went back to waiting, and we were so tired, and we walked around. We went to the sleep room to try and get some sleep, but we couldn't sleep. And finally, she went back to surgery about 10:30 a.m. Oh, I wanted to mention that Children's Hospital has tricks up their sleeves. So because Calista was awake when it was time to go back to surgery, of course, she was not going to willingly, take me, do my operation. She wants her mommy and daddy. So the way they tricked her was they had a car. They set her in the car, let her pretend to drive. They let us do a few laps around in a circle. And then when they went towards the direction of the surgery, they swapped us for them and forced us out into the waiting room. So she didn't even see us leave. And she wasn't freaking out because she didn't know. She thought we were behind her pushing her car. So, yeah, PSA, Children's Hospital has tricks. Good ones. Might not work for every child, but it worked for mine. So she went back about 10:30 a.m. We didn't get a page that the surgery was complete until about 3:30. So you can get an idea of how long a jaw distraction procedure lasts. So the plastic surgeon came out. Everything went well. He said, her stats are normal. It went in place beautifully. He has no doubts that everything will be fine. However, he had to remind me that some of the risks with the jaw distraction could be nerve damage or facial paralysis on like one side of the face, because I need to describe the way the jaw distraction procedure goes. So basically, they put a metal device here with attached screws to kind of open your chin so the bone go form on its own. So I don't know if I'm explaining that right, but he said that it went fine. He said it is a placement now because they have to put the device, they have to cut your face. Sometimes they have to go through nerves to get to the bone, and that could cause nerve damage or paralysis on one side of the face. But you won't know until the child wakes up, you know, from sedation, like how the face is going. So that's something that, you know, they will be looking out for during her recovery period. But from what they feel or how it went in an operating room, they said that everything went fine. So I was really relieved to hear that. Sorry, I'm so emotional.